Hello and welcome. My name is Katie Maschino. I'm a hunger outreach specialist at Hunger Free Oklahoma, a local nonprofit with the vision that all Oklahomans have enough to eat every day. Today, we're going to talk about what your practice can do in the work to build a hunger-free community. The objectives for this presentation include understanding the benefits of improving food security, recognizing risks for food insecurity, reviewing in-clinic action to protect and improve food security, and identifying ways to incorporate clinic to community connection to address food security in your community. But before we dive in, I want to review some quick definitions, framing, and scope of the issue of food insecurity. First, I want to review the difference between the definitions of hunger versus food insecurity. Now, hunger, we are all familiar with the physical symptoms, and this can include symptoms like an upset stomach, general fatigue, lightheadedness, among other things. While food insecurity is a more comprehensive term to use. This includes the physical symptoms that I just mentioned, but it also takes into account the mental and emotional toll food insecurity can take on a person or a family. Examples of these mental or emotional tolls may include worrying that there is enough food to eat at home or feeling anxious that your children are not getting enough to eat. It's also important to realize that economic hardship can fall on anyone. And when these circumstances fall on an individual or family, people are often faced with hard choices. And examples of these hard choices include having to choose between paying for housing, like rent or mortgage, utilities, like electricity or water, medical expenses or getting prescriptions filled, versus having enough food to eat at home. A common coping mechanism of parents is often to choose to eat less or maybe even not at all so their children have enough to eat. And to give a scope of the issue, generally, Oklahoma does tend to skew above the national average. And what we still have right now are pre-pandemic numbers. We do have estimates of how the pandemic has affected food insecurity rates, but they're still pretty fluid. So what we know is that Oklahoma typically falls within the top 10 most food insecure states, meaning more people in Oklahoma struggle with food resources than the average amount of people in other states. The pandemic and its many effects on our daily living have only made this number increase, and the need for comprehensive solutions to get regular access to food for families has only been emphasized during this pandemic. So let's consider the social determinants of health first as we look at the intersectionality of food security. And as we take a look at each determinant, consider how food insecurity, and remember it's the physical, mental, and emotional aspects, takes its toll and can manifest in each determinant. So first we have economic stability. And examples include employment, housing security, and poverty. And research actually ties food insecurity very closely to housing insecurity as well as poverty. And research also shows that communities with improved food security have strengthened labor force, increased educational attainment, and decreased healthcare costs. With education, examples within this determinant include early childhood education and development, language and literacy, high school graduation, and enrollment in higher education. Now, there's a lot of research that ties improved food security status to improved educational outcomes. Those outcomes include improved reading and math scores, improved language acquisition, decreased behavior and social problems at school, and higher graduation rates. Next is social and community context. This includes things like civic participation, discrimination, incarceration, and social cohesion. And we do find that there are many racial disparities in food security, with Black, Indigenous, and people of color experiencing food insecurity at higher rates. Next is neighborhood and built environment. This includes access to foods that support healthy eating patterns environmental conditions, crime and violence, and quality of housing. What we know is that nearly 20% of Oklahoma's census tracts are considered low income and low access by the USDA, meaning that in low income urban areas, the nearest grocery store is more than 1 mile away, and in rural areas, more than 10 miles away. We also see that in more rural areas of the state, children accessing summer meals, which I'll talk more about here in a little bit, it gets increasingly harder with transportation issues or sites being across a busy street that they're not able to safely walk across. Lastly, we have health and healthcare. This includes access to healthcare, access to primary care, and health literacy. Research shows that improved food security can improve many aspects of a person's health across the lifespan. In infancy and childhood, we see that there are healthier birth weights, children hitting developmental milestones throughout their childhood. And into adolescence and adulthood, we see decreased rates of chronic illnesses, especially those that are tied to nutritional status, like kidney disease, hypertension, obesity, and diabetes. We also see there is better management of mental illness, and this does include depression and anxiety. We also know that improving a patient's food security status can make it easier for them to follow medical guidance, adhere to prescribed medication, scheduling follow-up appointments, and any other behaviors that fall within health and healthcare. So some ways you can start working to prevent food insecurity. So these situations listed on the slide could trigger you to screen, gather additional information, or have a more in-depth conversation with your patients or families. Remember, anyone can be food insecure, and a common misconception is that if a person or a child is overweight, that there is no way they can be struggling with access to food or not having enough to eat, when that's actually not true. Here are a few examples that might signal someone is at risk for food insecurity. Those adverse childhood experiences, and I'm not going to go into the full list here, but any of those could trigger the need to screen. Changes in household income or job status among a parent or guardian. Changes in household size or composition. Maybe it's a relative who has moved in or a childhood friend needs to crash on the couch for a little while. And then any major life shifts, so death, divorce, homelessness, or illness can also be a trigger. Remember, anyone can experience food insecurity, so how can reoccurring screening be a part of your practice? So screening made easy. The two questions listed here on the slide are taken directly from the American Academy of Pediatrics. And patients who screen positive for food insecurity, if they answer often true or sometimes true on either or both questions. And these questions can be incorporated into your visits in many different ways. They can be put on intake forms or whatever check-in form, really any kind of form that is used in a clinic, or it can even be incorporated conversationally. It doesn't have to be word for word with what is listed on the slide, but this is just a general guidance as to how to phrase these questions. It is important to realize that screening is not just one and done. Like we saw on the last slide, life can change in a moment. And just because a patient or a family screened negative at the last visit, it doesn't automatically mean they will screen negative again. So just thinking back to the last slide, any of those major life shifts can happen at any time. So if screening does become a part of the regular office visit through those forms or through your conversations, it helps from families or patients falling through the cracks. And I just want to take a quick minute to highlight the resources that are included on this slide. These two questions are called the Hunger Vital Signs Screener, and they have been translated into many different languages in case that's useful in your practice. And I've also included two toolkits here, one from the American Academy of Pediatrics and one from Feeding America. Both have great information if you're looking for more information or support or resources in terms of this screener. So now we've talked about what to look for and how to screen. Now we need to connect clients and families to food assistance. We have three main ways to connect them to food resources. The first one being grocery assistance. Next is free and reduced price meals at school. And last is summer meals. So for grocery assistance, this includes the Supplemental Nutrition Assistance Program, Double Up Oklahoma, and the Special Supplemental Nutrition Program for Women, Infants, and Children, or also known as WIC. So with these grocery assistance program, individuals and families receive monthly benefits that help stretch the monthly grocery budget. Eligible households receive an electronic benefits transfer or EBT card to use at participating grocery stores and farmers markets. There are some limitations as to what can be purchased, but these benefits are meant to supplement, not replace a whole grocery budget. For free and reduced price meals at school, it's best for families to apply at their local school, and this application can usually be found on their school's website. And for summer meals, this is no-cost meals for children and teens 18 and under, and this is a great meal resource for the many kids and families across Oklahoma who rely on school meals. So a main resource I want to share today is Hunger Free Oklahoma's SNAP application hotline. So the main hotline information is that this is a toll-free number that families can call on their schedule. Hotline days of operation are Monday through Saturday. Calls can be completed in English, Spanish, Burmese, and Zomi. Calls typically take about 30 minutes to complete, and they are confidential. The link listed on the slide and this QR code will take you to Hunger Free Oklahoma's grocery assistance page for more information. I encourage you to pause here if you'd like to take a screenshot of this slide to print and post in your clinic. The Double Up Oklahoma program doubles the value of SNAP benefits at participating farmers markets and grocery stores, helping people bring home more locally grown fruits and vegetables. So Double Up Oklahoma provides SNAP recipients with a one-to-one match to purchase healthy, locally grown fruits and vegetables when they use their EBT card at participating locations. Eligible items to purchase with Duo include fruits, vegetables, and those are fresh, frozen, canned, or dried with no added salt, sugar, or fat. But it also includes herbs and plants that grow food. Double Up makes it easier for low-income consumers to eat more fruits and vegetables while supporting family farms and growing local economies. We call it a win-win-win because families bring home more healthy food, farmers gain new customers and make more money, and more food dollars stay in the local economy. And we also see a ripple effect of benefits from increased access to healthy food. The Double Up program operates at participating farmers markets and grocery stores across the state. More sites are being added regularly, so please check the link on the slide, doubleupoklahoma.org, for the most current information and sites. The next grocery assistance program is WIC. This program is specifically for at-risk households that include pregnant, postpartum, breastfeeding women, and children under the age of 5. There are WIC offices in every county. The state has offices as well as tribal nations, but families should be able to go to any clinic and apply. There is an abbreviated WIC application if the household is already receiving SNAP, so we encourage families to take this step to apply for SNAP if they think they're eligible for WIC as well. WIC includes specific products, nutritional products, that are identified to help with the nutrition status of women and children. This does include formula. It also provides regular nutrition education and developmental screenings at their local clinic. And a couple good things to know about WIC include that households can receive WIC and SNAP benefits at the same time. WIC does allow for higher income limits, meaning it might be accessible to households who may not qualify for SNAP. Foster children under the age of 5 can receive WIC benefits regardless of parent or guardian income. And citizenship status is not factored in when applying for WIC. So next, we have the free and reduced price meals at school. So I think it's important here to say that children who are on SNAP or their families are on SNAP are directly certified to receive free meals at their school. So that's another reason why applying for SNAP first is really beneficial for the whole family. This is one application, and this one application applies a student to receive breakfast and lunch at school. And typically school office staff or the school nutrition team are very familiar with this application and should be able to help families complete it. I do want to mention that school meals follow nutritional guidelines, and they have been proven to help children's overall health and wellness, as well as behavioral and academic performance at school. And making sure all children who are eligible have applied and are receiving free or reduced price meals at school not only helps the child by ensuring regular access to meals, but it also helps the family in not having to worry about where they're going to get breakfast and lunch, maybe even dinner at school. And it helps the school receive federal funding, and it helps the community in improving their food security status. Lastly, we'll talk about summer meals for all kids. Summer meal sites across the state provide no-cost meals to children and teens all summer. This is a meal resource for the many kids and families across Oklahoma who rely on school meals during the school year. Summer meal sites do not require proof of enrollment or any other kind of ID for a child to receive a meal. This includes any kind of citizenship or income status. Any kid or teen should be able to walk up to an open site and receive a free meal in the summer. The link listed on the slide here, the mealsforkidsok.org, is a tool to share with families in the summer months when school is not in session. This is a searchable map that will tell families where the nearest summer meal site is located. They type in their zip code, city, or town, and it will auto-populate with summer meal sites in their area. Food for Thought OK promotional materials are also sent out across the state. The bookmarks shown on the slide are included in library summer reading packets, and other promotional materials include posters and postcards. You can contact Hunger Free Oklahoma for promotional materials similar to the ones you see on the slide, or for more details about the summer meals, and the map. So let's start connecting the dots here in terms of connecting resources and networks. We encourage you and your clinic staff to share the resources and promotional materials shown in this presentation. Hunger Free Oklahoma can help you get flyers, posters, more SNAP hotline information, social media content, website links, whatever you may be looking for. We definitely want to help get you those resources. We do encourage you to regularly screen your patients. Remember, household status can change in a moment, and screening regularly and making it part of the routine office visit can help keep patients and families from falling through the cracks. In addition to these in-clinic interventions, you can start to build a hunger-free community. Hunger-free communities is the approach that Hunger Free Oklahoma uses when approaching our work. We strive to set communities up where families are able to sit in the middle of this diagram, where all three categories overlap so that families have comprehensive food resources to meet their needs. Remember, the grocery assistance program that we've mentioned today are SNAP, DUO, and WIC. The nutrition programs would include the free and reduced price meals at school and summer meals. And emergency food sites include things like local pantries, free congregate meals, backpack programs at school, or community gardens, among many other things. And to improve local food security, screening, sharing information, and referring out to resources are essential. And I think it's important to mention here that your clinic does not have to provide services that fall into each of the three categories. As long as you or your staff are aware and know where resources are in your community that fall into each of the three categories, you are providing comprehensive resources and help to the families who need it. Use the services and resources that are already available in your community so that organizations can collectively work to improve food security in the community. You definitely don't have to do this alone, but communication and collaboration are essential to making it work. And when we're considering a comprehensive approach, pause and kind of think of these three main bullet points here. How can you help the whole family? What programs, services, and other resources can reach the whole family from infants all the way through senior adults? What about year-round access and availability? Again, a lot of children and families rely on school meals, so how can we make sure programs are available all year? Typical gaps in services that we see are the out of school time, like summer, weekends, and holiday breaks. And including others in on the conversation. So in addition to getting everyone in your office on board and into the information loop, who else should be included? Again, consider those resources that are already available in your community. Think about how you can start building relationships and referrals. What resources or services might be missing, and how might you start to fill that gap? Even if the organizations or people just help get the word out or help refer people to these programs, it can be a huge help. Awareness is a huge piece of the puzzle. And what are the next steps? We encourage you to watch the family-facing version of this presentation for sample language and ideas on how to have conversations with families. Share both presentations and resources with your staff, peers, and within your networks. Consider how to screen, refer, and message to patients and their families. Visit hungerfreeok.org for additional information and resources, and click the link on the slide if you are interested in staying up to date by receiving Hunger Free Oklahoma's monthly newsletter. Lastly, here is my contact information. Feel free to reach out and I will be able to connect you with the best Hunger Free Oklahoma team member to help you. If you would like to stay connected with Hunger Free Oklahoma, I have included our website as well as our Twitter and Facebook handles so you can follow us on social media. Thank you so much for your time. I hope to hear from you soon.
Thank you, Katie, for that awesome presentation. That was a lot of really helpful information for our professionals that are looking to integrate this work into their clinics and what they're already doing. So if you could just tell us a little bit about your background, how you got into this work, and what really ignited your passion for it.
Yeah, so I'm actually a dietitian by training, and what got me into that, first of all, was just a love of food. Love to make it, love to eat it, love to grow it, love to tell people about it. And through my education and volunteering and internships and things, I found myself really drawn to nutrition and culinary education. And then the more experience I got and the more lessons I taught, I just kind of left classes thinking, it doesn't matter how well I just educated or taught this lesson if the people who I taught were struggling getting access to food or the food that I'm telling them they need to eat. And so kind of broadened my lens in that sense to talk about or learn more about food access and food insecurity and hunger relief. And then from there have just kind of continued to choose. I did some service work within public schools and worked for campus food pantry and food recovery programs while I was in grad school. And then I was lucky enough to find Hunger Free Oklahoma, and they had a position open, and been here ever since. Been here about 2 years.
It's awesome to hear just kind of your journey and how you found this specialty and special area of interest. What would you say are important considerations? You highlighted some of the screening benefits and touched on the connections between food insecurity and mental health for families, but what would be your advice, just kind of conversationally, for psychologists who are interested in getting into this work and maybe just highlighting the importance of it from your perspective?
Yeah, that's an excellent question. And, you know, one of the ways in which we kind of frame this issue for people who are just getting into it is, you know, imagine how you feel when you're hangry, or imagine how hard it is to concentrate and focus if you haven't eaten that day. And so just kind of trying to practice a little empathy and like put yourself in their shoes, especially when we talk about kids and behavioral or social problems at school. Just kind of trying to frame it as in like, if your body is craving those nutrients and that nourishment, you know, it makes it so hard to do anything, to learn, to concentrate, to work, to behave, you know, any of those things. So it kind of makes you feel on edge. And so just kind of whenever you start diving into this, just kind of putting that lens on. And then I'd say the other thing I would mention is just how multifaceted and complex this issue is. This issue does not exist in a vacuum. We see time and time again in research that if a person or family or population is food insecure, they are more than likely struggling to get resources with housing, with utilities, with medication, with really just, and you run the spectrum and it's almost always ties back to food insecurity. So just kind of put the lens on of like, how would you feel if you were hungry and trying to do all of these things and the things that you do every day, but then also tying it back to how just tangled this web is and how complex this issue can be.
Yeah, absolutely. It sounds like it not only affects the individual on multiple levels, but also these multi-systemic, you know, intersectionality, like you mentioned in your talk, that is helpful to consider. And just thinking from like a therapeutic perspective, yeah, it would be hard to implement some of the techniques that we're trying to do in session at home, or even during session if these basic needs are not being met.
Absolutely.
I think that's a great point that, you know, psychologists and other mental health professionals need to take into account when working with families and trying to provide support. So thank you so much for that. How has COVID, you touched on it a little bit, how it's exacerbated this problem, particularly in Oklahoma, but are there any other, you know, from your perspective, anecdotally or based on data, that COVID has impacted food security this past year?
Yeah, anecdotally, I don't have, like I said, we're still kind of figuring out what those hard numbers are. So hopefully when we get those, we'll be able to share them a little bit better and more concretely. What we have seen is, you know, we've really had to pivot the way that we try to get people to access these programs. The SNAP hotline that I mentioned in the presentation, we just built that within a couple of months. And I think we launched it in June or July of last year. So that's still very new, but it's been a huge help for a lot of families. And really, as far as the nutrition programs go, just making sure that schools and other community organizations, whether it's Boys and Girls Clubs or YMCAs or whatever that are trying to feed kids, making sure that they know that these resources are here and available to them, and know how to opt into them so that they can get some of those reimbursements that make those programs a lot more viable. And then I would also say that there's just been an increased demand on those emergency food sites. So if you remember that little bubble that was towards the end, it had the 3 different categories, and emergency food has just been in high demand. Those food pantries, those congregate meal sites, although with COVID and not being able to congregate in one place at one time has made those have to pivot on a dime as well and try to figure out some kind of meal distribution that's not just like a typical like family buffet style. So, but then on the flip side, you know, there's also been like Oklahoma has stepped up in a very traditionally Oklahoma standard kind of way. And there's a lot of really cool and innovative partnerships and collaborations across the state that have popped up through this. And, you know, there are some flexibilities, especially with the federal nutrition programs that have allowed it to be a little bit easier to reach more people, which we are hoping will continue at least in some form or fashion after, just because I think we're making the case as to why it's so important to drop some of the regulations and so that we can reach more people. But yeah, so there has been increased need, but we've also been able to see just how Oklahomans and communities step up for each other and step up in a time of need.
That's great to hear. It sounds like, well, this has exacerbated some existing, you know, concerns that, you know, beefing up some of the programs that you already have in place and reaching more families that way. It's kind of been a push to stretch some of the tools that are already out there. And like you said, the policy that exists surrounding these issues, and hopefully those changes will be sustainable moving forward. How do you see along those lines the future of the food insecurity work that you and your colleagues at Hunger Free Oklahoma are doing? Any goals you can share with us or next steps for outreach?
Yeah, you know, something that we as a staff have talked about is just how much more surface level this issue has been. A huge piece of what we're doing now, because we still are a very young organization. We're in our 4th year, and just the outreach and awareness and the education around food insecurity, who it affects, how it affects them, you know, the tangled web that it is, like I mentioned earlier, that is a huge piece of what we do right now. And so with COVID and with the need being so much more apparent and surface level, it's really been able to change our conversations to saying, instead of us trying to not convince, but just kind of like say, hey, this issue is here, like we're just highlighting it. It's been able to help us flip that conversation to say, okay, you know, this is an issue. Let's figure out what we can do, how your organization or community can plug in. You know, start small and grow sustainably is a huge piece of what we try to say. But people who are contacting us are, you know, right in step with us and saying like, this is an issue, we need to get going, rather than us trying to come in and say like, hey, this is an issue, did you know about it? So yeah, as far as goals, it's just continuing to increase participation, whether that is in SNAP benefits or WIC benefits, growing in other programs. There are some more programs out there that we just don't know a whole lot about yet, that in the background we're trying to learn more and build relationships, but just kind of continuing to grow our tool belt, our toolbox, and just again, trying to face this comprehensively. It doesn't exist in a silo and we can't fix it in a silo. So just trying to gain more knowledge and expand our reach, and so that hopefully in turn more individuals and families across Oklahoma have better access to resources as well.
Absolutely, that structural change as well as the dissemination of the resources and programs that are already available, connecting the web in other ways, a resource web, I guess, instead of you know, some of the challenges that exist. Thank you so much for sharing this information. I think a lot of our colleagues will find it really helpful and will hopefully be implementing some of the tools that you mentioned in their work very soon.
Awesome. Thank you.